Hello and welcome to a Health Podyssey. I'm your host, Alan Weil. I'm excited to announce that Health Affairs will soon release the second season of the Research and Justice for All podcast series, a series focused on achieving health equity. Our second season was developed in partnership with Deloitte, and it looks primarily at the drivers of health. So in advance of the series release, I wanted to sit down with Jay Bhatt, Managing Director, Deloitte Services, LP, the Deloitte Center for Health Solutions, and the Deloitte Health Equity Institute. In today's episode of A Health Podyssey, we'll discuss the work of Deloitte's Health Equity Institute and how it's seeking to address the drivers of health. Dr. Bhatt, welcome to the program.
Thank you for having me. Thrilled to be in conversation with you all.
So I'm really looking forward to this. I have to say, when we started working with you all, I think of Deloitte, name's been around for a long time. You're just this big consulting firm, accounting firm. Those are your origins, as I recall. So how did Deloitte go from its roots to creating a Health Equity Institute?
Well, thank you for the opportunity to be here today. At Deloitte, we define health equity as a fair and just opportunity for everyone to achieve their full potential in every aspect of their health and well-being, regardless of race, gender, ability, status, or zip code. And that includes considering a person's holistic health needs and caring for the upstream drivers of health. Those things such as healthy food or transportation or housing that all have an impact and influence on health outcomes. Deloitte established the Health Equity Institute to help address and advance health equity as an outcome, recognizing the profound disparities in health outcomes across different communities, illuminated certainly by COVID-19, as well as the environment during the years of COVID where there was social unrest. The Institute was launched in 2021 with a mission to drive strategic support of community organizations and initiatives that impact these health gaps. In addition, it's about business leaning in and taking a leadership role on addressing the issues of their community, their own organization, products and services that they deliver, as well as those that operate in the ecosystem. And so this is also part and parcel our work and purpose at Deloitte. And our commitment to the space is not new. The work around health equity, Deloitte has been serving clients around, engaged in pro bono work, engaged in communities, civic work across the country. But this harnesses the capabilities and the work together to create even more impact at scale. And we're able to support our client service teams, support our purpose in DEI office strategic areas for community impact.
So that makes a lot of sense to me. We hear organizations all around in healthcare saying they want to address these issues, and basically this is another domain of work where you can help them do a good job. I do wonder how the Institute fits into the overall work of Deloitte. Is it a standalone? Is it you mentioned, does it sort of feed into all sorts of engagements? Like how does an institute fit within a large consulting organization?
Sure. It's our strategy and intent as an organization to prioritize work on this issue and a number of others that are oriented around financial inclusion, workforce development, education. The Health Equity Institute in the U.S. is one of a number of health equity institutes within the global firm. We started with the U.S., Africa, and India. We've since added LATAM and Europe as other health equity hubs. And the Deloitte Health Equity Institute is deeply integrated in the broader purpose work of Deloitte, really exemplifying our commitment to advance health equity as an element of our strategy, mindset, and operations. In other words, it's not a side hustle. It's part of how we do business and how we engage our talent and how we impact communities. And so that health equity is not just a moral imperative, but is an economic one that requires business solutions as well. And we're focused on activating leaders, driving place-based change, fueling innovation, democratizing insights, and creating measurement tools to help close health gaps. by embedding health equity into the fabric of how organizations invest, operate, and collaborate. And so there's some examples of how we approach this work within our own organization. For one, Deloitte has an in-house integrated mental health services team, which can connect employees with quality and mental health services. And this initiative is intended to support our employees' mental health needs, demonstrating our commitment to health equity in the workforce. And it's available in a way where there's access to mental health professionals who speak 16 languages and represent 8 races and ethnicities, which is one step towards helping employees feel represented in the care they receive. But we also think about our talent strategy, our work around skills-based volunteering, and embedding our people and professionals in the work we do to advance health equity. And then the other is around offerings. As the largest professional services organization in the health sector, the Institute works with services to help elevate the importance of health equity across our efforts. And then we work with clients intended to benefit both their internal workforce and their external consumers and communities. And so we then also work across communities in the country. So it's part of our Deloitte Purpose and DEI office, contributing to 1.5 billion social impact commitment over 10 years, which are the pillars I spoke to earlier around health equity, education, workforce development, and financial inclusion. And then we bring collaborators together, like our work with the Global Health Equity Network and the World Economic Forum, where CEOs come together who have committed to a Zero Health Gaps pledge and are advancing health equity in their organizations and their communities and through their services. And then there's things like Yes San Francisco, which is bringing a coalition of collaborators together around sustainability, which then can also grow to other places around the country. And then we drive social entrepreneurship, so supporting women and historically underserved communities who are historically marginalized business owners and supporting them in their growth of entrepreneurship. And so we've increased our spending on diverse suppliers as well to over $1 billion, surpassing our goal 3 years ahead of plan. So this is a commitment, to supporting and empowering diverse businesses.
Well, that I guess that answers my question of whether it's a standalone or it's embedded. It sounds like it's embedded in lots of different ways. I'd like to turn a little bit to sort of your role. You're trained as a primary care physician. How did you migrate from that training into a role as managing director?
Well, I'm the son of 2 South Asian immigrants. My father, a pharmacist on the south side of Chicago for most of his life, and my mom, a factory worker. And I saw up close challenges individuals and families confronted when they had to decide between their health and food, or health and housing, or how they managed to just get through each day. So this really started me down a path of asking questions of why are things different for different people in different places, and led to a commitment, and a pursuit of health equity as not only a passion, but a profession. And as a primary care physician, I have historically cared for individuals, families, and communities in the public sector at Federal Qualified Health Center, public hospital. But when I have also thought about impact, I've thought about it at scale. And so I've thought about different ways to do that. And so I've been fortunate to work the Chicago Department of Public Health, the American Hospital Association, the Illinois Hospital Association, health plans, and now Deloitte, really to take the experiences and skills I have to really impact outcomes and health equity at scale. And when you get a chance to work with talented people at our organization at Deloitte, as well as solve tough problems and work with C-suite and board leaders across Fortune 100, Fortune 500 companies to influence impact and accelerating that impact, I think it's an exciting opportunity. And so there's an opportunity where we could have thought leadership shape mindset and strategy and action, as well as work with an organization that embeds purpose as part of how they do business, and that good health and good business go hand in hand. And so that health equity or advancing the best health for everyone is an opportunity to work through in different ways. And so I'm excited about the opportunity to contribute to seminal research that is used by business and community-based organizations and policymakers, and also invest with community-based organizations to advance health equity, but also help support the work that our consulting teams do around this issue of health equity, with clients.
You may have foreshadowed then my next question, because when I look at the goals of the Institute, they're to create exponential change. And, we work in a world where we're focused, honestly, often on incremental change. And in equity work, it's hard to make even small changes. So exponential change is a pretty audacious goal. I think I get where your audacious goals come from. You just gave me some insight into that. But what do you really mean by exponential change? And what does it take to achieve something at that level of scale?
Yeah, I mean that exponential change is bold action, significant shifts to close health equity gaps, but also create value and opportunity for everyone. And to achieve health equity at scale, we concentrate on impacting root causes of health inequities, such as systemic racism and bias within health systems, structural issues, and significant inequities in the drivers of health. And so we acknowledge our limitations, understand that we cannot transform the system alone. However, our capabilities position us to convene, to shape this shift by fostering high impact and cross-sector collaborations, conduct research, convene, foster dialogue, use technology and analytics and our capabilities in that space to support community-based organizations and business in different ways to advance health equity. We also are committed to producing data and catalyzing conversations that highlight health equity as a core business issue, that's everyone's business, and that we are implementing a three-pronged strategy to help accelerate health equity in communities and scale it nationally. And each component of our strategy supports the others, forming an integrated approach. So, as I was alluding to earlier, one, strengthening place-based change. We help community-based organizations advance health equity within their geographies by supporting interventions and generating evidence for broader learning, scale, and change. And then driving health equity innovation is our second lever, where we leverage Deloitte's resources and collaborations and to spark and nurture creative ideas and work with, for example, accelerators that support social entrepreneurs that typically don't have opportunities around advancing health equity. And then 3 is equipping key decision makers with tools, analytics, insights to help make a tangible impact both locally and nationally, so that they can create a domino effect of health equity actions and change across the private and public sectors. And this multifaceted strategy is intended to help us achieve this goal of exponential change. And so by combining diverse resources, specialized knowledge, and perspectives, we can tackle complex health challenges and do it with community organizations, coming at it humbly and understanding that we don't have all the answers. We want to just work collaboratively together to get to better health for everyone.
Well, I want to go a little deeper into some of the specific initiatives. You've set the stage nicely for why you're doing the work and how it fits within the Deloitte enterprise. We'll discuss some specifics after we take a short break. And we're back. I'm speaking with Dr. Jay Bhatt about advancing health equity at Deloitte. Before we took our break, we learned a lot about the Health Equity Institute and how its work fits within the broader organization. I want to dig a little deeper. I know when you have lots going on, it's hard to pick a favorite, and I don't really want to ask you for a favorite, but I wonder if you could say 1 or 2 areas of focus that you have at the Institute that really gets you most excited?
I would say 1 is around mental health. So we've got a body of research work that we've done in collaboration with Meharry Medical College School of Global Health, which was an analysis to understand the economic impact of mental and behavioral health inequities. So the study explored expenditures linked to mental health inequities encompassing chronic physical health conditions, use of emergency department, losses of people being able to work, premature deaths, and our findings indicated that the avoidable expenses due to mental health inequities are projected to be $477.5 billion annually, potentially rising to $1.3 trillion per year by 2040 if we don't make significant changes to our current approach. And so that is also aligned with our community-based investments, where we're working with Unidos US to support youth mental health in 5 markets around the country, taking a model that they saw positive impact in rural communities and bringing it to urban areas. And then the other is around LGBTQIA plus youth and the Trevor Project. And we're supporting increase in crisis counselors because the demand, unfortunately, is significant, and and having the right resources to meet the needs to address those at risk of suicide. So I think we're really excited about that work and the impact it's having. And then the other is with the American Heart Association, SHRM Foundation. They just, through our Global Health Equity Network with the World Economic Forum, where we're having CEOs and C-suite leaders come together to talk about how, as employers, they can impact health equity with their workforce through their products and services and in community. And I think that work from both tools like a business case tool to research to actions that are being taken in companies to advance health equity, it's creating that kind of domino effect of exponential change we were talking about earlier. So I'd say that's what I'm really excited about.
That's great. Here at Health Affairs, we're always focused on data, and I saw that you have some data and dashboard kind of projects at the Institute. Can you say a little about those and why you are making an investment on the data side?
Sure. These are tools that we use to better understand the extent of the challenges we're trying to solve for, evaluate the solutions we support, and summarize the impact we're able to make. And dashboards to help illuminate opportunities for intervention to evaluations of interventions. Your data is certainly an important tool. And then key decision makers can invest and allocate resources based on the greatest potential impact. One of the series we've developed is called HEXA, the Health Equity Through Analytics series, which leverages the Institute's data and analytic capabilities to quantitatively explore the connections between health drivers and outcomes. The novel approach here is that it's multidimensional integration of diverse data sources, which allows us to deepen our knowledge on drivers of health and inspire conversation and catalyze collaboration to address those root causes I pointed to earlier. And it has an approachable format in understanding the non-medical factors influencing health and health outcomes, and then being able to take action. Volume 1 centered on education, examining the effects of literacy and numeracy in chronic conditions. We often don't talk about that as much as a driver of health, but it can be significant in certain populations and impact health behaviors and health utilization. Volume 2 addresses social connectedness, investigating the impact of physical social connections, population level, both within family units and broader communities, and the impact on health.
Well, I was going to ask you to go a little deeper in the drivers of health. You explained what you meant by that earlier in the conversation, but you just gave an example. I'm so glad you did, around illiteracy and numeracy. When I hear, and I'm in a lot of conversations where people say they're talking about, what often people refer to as the social determinants of health, I basically never hear that come up. People tend to gravitate back to the same list of critical issues, don't get me wrong, but it seems quite narrow. So I wonder if you could say a little more about how you came to the term drivers, and particularly how you operationalize that, given, as I said, you just used an example that's sort of outside of where most people focus.
So social, economic, and environmental factors can account for 80% of health outcomes, whether positive or negative. And one we often talk about this in the industry as social determinants of health, but I think often that gets confused for social needs or systemic and structural issues. Even if we take the example of housing, helping one of my patients who has mold or poor housing conditions improve that or move to another housing environment could be addressing that need, social need of healthy and affordable housing. But then a community may just not have adequate and affordable housing, and that's a driver of health. And then the systemic structural issues are the policies over many years or history over many years that may have created disinvestment in the community or challenges with having affordable housing. So that's one example, of the range and the continuum. And we call it drivers of health because we don't necessarily believe things are determined in the way that we think about social determinants of health. But we know that the data is very strong around these drivers of health and health outcomes. So food insecure individuals are 48% more likely to be diagnosed with diabetes. People with greater social connections have a 50% reduced risk of early death. And then there's also the issues, as I spoke about, around literacy, that has an impact on how people understand healthy behaviors or engage in the system. There's also inherent complexity within the different drivers of health. This is not one, often it's intersectional and it's multidimensional. People may have 2 or 3 different drivers of health, and each driver can influence the others, impacting individuals' health and well-being over time. And by better understanding the root causes of each driver of health, our Health Equity Institute works with collaborators to employ multidisciplinary strategies to help address gaps and advance health equity. We use the term drivers to reflect a shift from static determinants. This places an emphasis on how these factors can actively influence health outcomes and underscore the potential for interventions to advance health and well-being. We are dedicated to integrating drivers of health in our collaboration strategies, addressing systemic challenges and promoting health equity.
Well, as we bring our conversation to a close, I want to return to a theme that's come up around community engagement. And I know that's central to the work that you do. When you move away from this sort of patient in front of you who has mold in the house to the structural and contextual issues you describe, if we're going to make progress, we have to do it in conjunction with the communities where people live. So I wonder if you could say a little bit about how your work seeks to engage with communities and what you feel like you're able to achieve because of that dimension.
The Deloitte Health Equity Institute considers community engagement essential for addressing drivers of health, like building respectful relationships, having humility, listening, obtaining perspectives from proximate community members are key for us to crafting and co-developing impactful solutions. We even developed a community voice initiative so that our community-based collaborators and those impacted by the issues are contributing and offering a point of view and perspective on what we should be researching or invest in or how we should be doing our work with community. And one example of our collaborations in communities with United Way Worldwide, which focused on expanding local efforts to improve maternal health outcomes. The collaboration strives to assist community organizations in identifying root causes of maternal health inequities within their communities to help inform solutions. We've also worked with Morehouse, training 100 plus community health workers, including doulas, patient navigators, and mental health workers, to deliver high quality, culturally sensitive health and social services, helping reach more than 80,000 individuals. And I would say that as part of this work, we did community member listening sessions that helped the community-based organizations identify areas for improvement. And then the dialogue presented opportunities to better support individuals impacted by the services throughout their journey. And we think that this has just got to be core to how we do the work. Another example is through our work with New Profit and social entrepreneurship, where we supported New Profit in the launch of its inaugural health equity and mental health equity catalyzed cohorts where we have supported with collaborators a number of early stage organizations focused on promoting health equity by addressing the systemic factors influencing drivers of health. One is around housing parity, led by Bree Jones on gridlocked housing markets in West Baltimore, creates upfront demand for affordable housing in mostly abandoned neighborhoods. On food, the FarmLink project, led by Ben Collier, focuses on combating food insecurity and by identifying bulk surplus produce at farms and distribution facilities and transporting to local communities in need. And so this cohort model has really been great for folks to learn from each other, to build with peers and explore interdisciplinary approaches to advancing health equity.
Well, Jay, it's great having this chance to get a deeper look into the work that you and your team do. I've been aware of the Institute and have heard you describe it, but this is a much more comprehensive understanding than I've had before. And it's really interesting. You know, when I first saw, as I've noted in our conversation, your reference to exponential change, I thought that sounded a little maybe overly ambitious, but actually, given the different dimensions that you bring to this and the multiple ways that you intersect with both communities and very highly resourced organizations that are turning to you for advice, it does seem like there's a real opportunity for major change coming out of this. So I appreciate the explanation and the passion you bring to your work. Dr. Bhatt, thank you so much for being my guest today on A Health Podyssey.
Thank you so much for having me.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about A Health Podyssey.